Hello and welcome back to Nibs. Today, we're focusing on a virus that has been making headlines, the Mpox virus, previously known as monkeypox. We'll look at what Mpox is, how it spreads, its symptoms, and common management, medication and vaccines, and ways to protect ourselves. Let's dive in. Mpox, formerly known as monkeypox, is a viral disease that was first identified in 1958. It was discovered during 2 outbreaks of a pox-like disease in colonies of monkeys kept for research, which is how it got its initial name. However, the primary reservoir of the virus is not monkeys but small mammals, particularly certain species of rodents. The first human case of Mpox was recorded in 1970 in the Democratic Republic of the Congo. Since then, most human cases have been reported in rural, rainforest regions of Central and West African countries, where people are more likely to come into contact with infected animals. The virus is considered zoonotic, meaning it can be transmitted from animals to humans, and it occasionally leads to human outbreaks. Transmission generally occurs through direct contact with the blood, bodily fluids, or cutaneous or mucosal lesions of infected animals. Human-to-human transmission can occur through respiratory droplets, direct contact with bodily fluids or lesion material, and indirect contact with lesion material, such as through contaminated clothing or linens. After an incubation period of 5 to 21 days, Mpox symptoms start to show. Early signs include fever, headache, muscle aches, back pain, and swollen lymph nodes. Soon after, a characteristic rash develops, often beginning on the face and spreading to other parts of the body. The rash evolves from flat red spots to raised bumps, then to fluid-filled vesicles, and finally to scabs. The Mpox virus targets cells in the skin and mucous membranes. It triggers an immune response, leading to the rash and other symptoms. Swollen lymph nodes are a distinctive feature, as the body fights off the infection. Most people recover in 2 to 4 weeks, but the disease can be more severe in young children, pregnant women, and those with weakened immune systems. Preventing Mpox involves minimizing contact with animals that might carry the virus, such as certain rodents and primates. It's also crucial to practice good hygiene and use personal protective equipment when caring for someone infected. In some cases, smallpox vaccines have been used for Mpox due to the genetic similarities between the viruses. If you suspect Mpox exposure or symptoms, seek medical advice immediately. Vaccines and medications for Mpox. Due to the genetic similarity between the smallpox and Mpox viruses, smallpox vaccines have been shown to provide cross-protection against Mpox. Historically, the smallpox vaccine was up to 85% effective in preventing Mpox. People who have received the smallpox vaccine may have some level of immunity against Mpox. Jynneos. This is a more modern and specific vaccine that was developed to protect against both smallpox and Mpox. Jynneos is a live, non-replicating vaccine that has been approved in the United States and other countries specifically for Mpox prevention. It is recommended for individuals at high risk of exposure, such as healthcare workers and those who have been in close contact with confirmed cases. Medications such as tecovirimat. This antiviral drug has been approved for the treatment of smallpox but is being used under investigational protocols to treat Mpox. Tecovirimat works by inhibiting the viral envelope protein, which is necessary for the virus to spread. Cidofovir, another antiviral used to treat severe cases of poxvirus infections. It is an alternative treatment option but comes with more side effects and is less specific compared to tecovirimat. Brincidofovir. This is a derivative of cidofovir with fewer side effects. It has been studied for use against Mpox, but like cidofovir, it is generally reserved for severe cases or as an investigational option. While these vaccines and medications are available, their distribution and accessibility might vary depending on the country and the healthcare infrastructure. Public health authorities in regions with outbreaks usually prioritize vaccination for high-risk groups and healthcare workers. Ongoing research and monitoring continue to improve our understanding of Mpox and enhance the effectiveness of prevention and treatment strategies.